Hello and welcome to the another day class from your very own Nepali nurse educator. In previous classes, we studied about electrocardiogram, how it is predicted, and which topics are important according to NCLEX exam. So in today's class, we will be discussing about NCLEX favorite cardiac drugs. These are the most known drugs for NCLEX. Here today we will be knowing the drugs, we will be knowing the action and know the nursing management for it. So let's start from digoxin. It is one of the very high NCLEX drugs. Remember, you don't need to memorize everything. Okay, digoxin, let's start. It is used in heart failure and atrial fibrillation. It does two things: slows the heart and make it pump stronger. Okay. Most important rule here, nursing priority is take apical pulse for 1 full minute. If the heart rate is less than 60, make sure that you hold the drug. Toxicity signs are nausea, vomiting, yellow vision, blurred vision. The patient might get confused, especially in elderly people, and arrhythmias. Memory line for digoxin is think slow and strong heart. Slow but strong. Okay. So next, let's move to the beta blockers. These groups of drugs are the drugs that ends with lol. For example, metoprolol, atenolol, propranolol. They are used for hypertension, tachycardia, and heart diseases. So what do? They slow down the heart and lower down the blood pressure. And side effects are bradycardia, the heart will be slow, hypotension, the blood pressure will be too low sometimes, bronchospasm, which is one of the most important one. Very important, these drugs should be avoided in asthma because one of the side effects here is bronchospasm. Next one, fatigue, and the patient might have cold extremities. And NCLEX warning here is avoiding asthma. Remember that. Memory line for beta blockers are LOL, LOL equal to low heart rate. Okay. So now third we have calcium channel blockers, CCB. Example of these drugs are amlodipine, verapamil, and tetiazine. So let's talk about the use of calcium channel blocker. They are used for hypertension and arrhythmias. So what do? Key action is to relax blood vessels and slow down the heart. Okay, let's talk about the side effects of CCB or calcium channel blocker. Peripheral edema, which is very important, and then hypertension, bradycardia, and constipation. So memory line here is calcium means it causes contraction. If you block the calcium channel, it will relax. Okay. So next we have nitrates or nitroglycerin. It is used for chest pain or angina. What are the key actions? They open blood vessels and reduce workload of the heart. Side effects are headache, hypertension, dizziness, and fainting. And NCLEX rule is do not give with sildenafil or Viagra within 24 to 48 hours. Remember that. So memory point here for nitrates is nitro makes the vessels open, that helps to decrease the pain. Okay. So let's move to the next one, atropine. It is usually given for slow heart rate or symptomatic bradycardia. What do? It helps to increase heart rate. So NCLEX rule here is slow heart, remember atropine. Next we have adenosine. It is used for SVT, supraventricular tachycardia, or regular narrow tachycardia. It slows down the AV node conduction. Okay. Here one of the important point to remember is while administration, make sure you push the IV rapid and flush immediately. So what are the side effects? Side effects are flushing, chest tightness, shortness of breath. And one of the common and important side effect is transient asystole or brief cardiac pause. The patient might feel the chest is tight and you might feel like dying for a few seconds. It is a brief pause. Okay, now let's move to the golden memory line, which is very important. Low heart rate, give atropine. Acidity, give adenosine. Weak heart or atrial fibrillation, give digoxin. High BP or fast heart rate, give beta blockers. Chest pain or angina, give nitrates. High blood pressure or arrhythmia, give calcium channel blockers. So let's talk about drug safety reminders. Always check pulse before giving. Let's throw in drugs. Make sure you do it for 1 whole minute and hold if the heart rate is lower than 60 beats per minute. Monitor blood pressure closely. Assess for any drug interactions. Make sure you assess the patient properly, not just the numbers. Okay, know the drugs, know the action, and save the lives. So remember, NCLEX is not about remembering the drugs, it's about when to give the drugs and how. Now we are done for the day. Hope you guys understand the things, and if you have any queries, let me know in the comment section below. Thank you everyone. Happy studying. All the best to all the NCLEX aspirants. I'll be back with the next video soon. Thank you.